Welcome to the Art of Patient Communication. I have the pleasure to interview Ms. Payal Merchant today, who is not just a very passionate physiotherapist, but also runs her family dental clinic with her husband and is a mum to two beautiful boys. Despite her busy life, Payal's greatest strength is to be calm and composed in the middle of a storm. A few years ago, she faced a hip injury, which became a journey of resilience and learning for her, and how it actually impacted the way she communicated with her patients. Let's begin. Welcome to the show.
Thank you for having me, Kritika.
Payal, can you walk me through a little bit about your physiotherapist journey in Australia?
Yes, absolutely, Kritika. I came to Australia in 2012 because I'm an overseas trained physiotherapist. So obviously we have to go through Australian Physiotherapy Council examination. So I started prepping for that. I was very blessed because I came to Mackay, Queensland. So I was able to work as a physio assistant at Mackay Base Hospital. And it's a fabulous big institute where we are a team of nearly 25 physios and
Wow.
then at least another 15 to 20 allied health staff. Working as a physio assistant and under so many other, senior physiotherapists, I got an insight of, physiotherapy in Australia. I was so happy, but I was also very anxious and nervous because what I had studied, nothing made sense because the approach of physiotherapy as in other professions, it was very, very different.
Yeah.
So basically, I'm working as a physio assistant. I got through my exams and then I applied for a role of physiotherapist in the same hospital in 2013. Yeah, and then July 2013, I started working as a physiotherapist at Mackay Base Hospital. 2013, and now it's 2025. So yeah, nearly 12 years. Yeah. I mean, obviously, after that, I also started my family. So, having kids. So I've been not working full time, but yeah, I've been working part time in that space. Yeah, throughout this last 12 years.
Yeah.
Yeah.
So, you have family, as you said, and you're also managing
Yes.
your family dental business.
Yes.
But you're still doing the physio. So, obviously, there's a lot of passion still.
Yes, absolutely. I
Yeah.
think the time that I spend at Mackay Base Hospital, I think that's the time that keeps me motivated.
Yeah, right.
Because I didn't understand the real meaning of physiotherapy while I was doing my uni. I had worked for 2 years back in India as a physio. But again, I knew I didn't want it to become an engineer. And then there's only one scope left. I wanted to be in a medical space. So then physiotherapy came. So I just got along with the uni course as everybody does without not realizing a real passion towards it. But I think when I came and started working at Mackay Base Hospital as a physio assistant, the way physios were helping, the patients at surgical ward, medical ward, at outpatients, in community, it's like start to finish. It's not just like a joint or it's not just like an injury that they're treating. They are involved in every aspect of patient management. And I was like, wow, this is what actually physiotherapy means. It's an applied science that not only helps you to manage an injury where you only sort of, providing an exercise prescription or giving them strategies, but you teach people to sort of apply it in every aspect of their life.
Yeah.
Work, home, interpersonal relationship, it affects everywhere. So that's where I felt like, I was enjoying myself in that space because I was an assistant, I was not a physio, I was, a bird in the room having a look from each and every point of view, plus not having any responsibility of a physio.
Yeah.
I think that was very refreshing. And I had like this, I was very motivated to do my exam. So I was like, yes, that was my goal and I wanted to do it. So cut to when family started and kids came. So, your passion sort of, dwindles away.
Yeah.
And then we decided to have a dental practice. So in between, a lot of things happened. So physiotherapy obviously took a back seat. But I will always remember that passion that I had and the things that I learned from various people back in the hospital, which will always make me feel connected towards physiotherapy.
Yeah.
And as we're going to talk about today, my personal injury, I feel like being a physiotherapist obviously gives me that insight of understanding a human body a little bit
Yeah.
more than
Yeah.
anybody else. But at the same time, there are also, like, being a health professional, when you yourself become a patient, when you yourself go through some things, being a health professional, because you know so much, sometimes it also hinders your recovery.
It comes in the way.
So, yeah. And I think in between going through this phase, I had completely felt lost professionally, because I practice manage our business and being a homemaker, and then being a little bit away from physio in a way that I did not wasn't able to keep myself up to date with my skills. So at some point you feel like your confidence goes away.
Yeah.
A lot of things, like, brush off, and you feel like, what am I doing? Like, do I even like it? Do I even want to be in this space? But I feel in the past couple of years, my journey has been such that a lot of doors seem to be opening now. I feel like I know what I want to do. I feel like I still want to continue on this journey of a physiotherapist, because it is a very, very noble and humble profession. And I think even if you can help one person at a time, because I have been that person that has been looking for help for a long time and I didn't find any, it'll be a privilege, and it's something that brings satisfaction to you, and that is, you can't compare it to anything else.
No.
Yeah.
So, when you say that when you were at uni, Payal, obviously it was looked at a transactional relationship with the patient. They have a problem or you fix it, and then your
Yes.
relationship is done.
Yes.
Whereas in Australia, when you were at Mackay Hospital, you saw that how physiotherapists were involved in various
Aspects of life.
aspects of life.
Yes.
And I think, did you think that connected you more to the patient and you felt more involved in their recovery?
Absolutely. And because that is what people expect from a physiotherapist over here. They expect from you as well to sort of explain, make them understand every aspect of what's going on with them. Obviously, we come in between, like, your specialist, your GP, there are many multidisciplinary team involved, but us as Allied Health, a part of Allied Health, we are the people who sort of are a bridge in between. It provides a better opportunity for us to connect with our patients, because we see them more regularly. We sort of delve into areas where the other professionals would not go.
Yeah.
So I think it definitely gives us a very good opportunity to connect with our patients at a level where they feel very comfortable, because that's what we do. That's what we are there for, to help them out. Yeah.
You are more so like an allied generalist who is
Yes.
looking after the patient's well-being and their other physical issues.
Absolutely. And sometimes, like, when you say well-being, like, there are areas where we feel like, oh, this is something that obviously it's not out of my scope of practice, but you can see some flags, and then you get an opportunity to sort of make referrals to the right professional or whatever that needs for them to be done in that moment. It's a great position to be in that team, I feel.
Yeah, look, I can definitely see and feel the passion coming through. That's great. So, Payal, like, look, we've all, you are a mom, busy mom, and you have a business, and you have the physiotherapist role. So tell me how all of this was involved when you actually got injured.
Yeah.
So a little bit of a history about your injury.
Sure. It wasn't an injury per se. Like, I didn't have an episode, or I didn't have an experience where I was doing something and something mechanical happened and then I had an injury.
Right.
It was an insidious onset. So it was a very gradual process that happened over a period of time. Like, I wasn't getting any results, I wasn't getting any better, and bam, it was like, oh, you've got this. 3 years back, nearly 3 years back, it started as a left hip pain. So obviously, as a physio, and by understanding the joint and everything, it felt like, oh, this must be something more muscular, more tendon related pain. So if I'm trying to be precise, it felt like it's like a left hip bursitis or left hip tendinopathy
Okay.
pain. So obviously, being a physio, I feel like in the first half of my journey, I did take it on myself, like, or because you feel like you've been doing everything right, understand things more than anyone else. So how could you not manage it in the way that it should have not reached so far?
Yeah, like you would have been right.
Yeah. And I shouldn't be blaming myself at all, because some things are not
No,
in your
of course
control.
not. Yeah.
Like, you've got two eyes, I've got two eyes, my joint and your joint are same. Like, we've got so much similarities. Every human is same, but at the same time, we have got our own quirks. We have got our, uniqueness, and that also applies to our anatomy. That also applies to our innate cells and genetics and DNA. So, when we are in uni, we study anatomy, we study like everything in detail, but then you also have that applied anatomy.
Yeah, the variations.
The variations, yeah. So, but nobody knows that until it surfaces as a problem, or it surfaces as a symptom, or something that you feel like, oh, this is not right. Like, this is a bit different to someone else. So in my case, like I've never had anything like that until then. Everything was perfect, like, 2 pregnancies, 2 deliveries, like, everything was how it should have been. I had no issues, no complications whatsoever. But after my second pregnancy, being from an Indian background, we have got a certain ways of, like, picking up kids and like holding the baby and making them sleep and things like that. So, we cross our legs and we put the baby on the lap, and then you would like, tap the baby on the lap and try to put them to sleep. So I used to do that a bit. And that was the first time I felt like, ooh, that's a bit like, after a while I was feeling a bit sore in my left hip. But nothing to the point where I was like, ooh, this is concerning. I need to get it checked, or I need to do something about it. And then it never sort of bothered me. And then once my second child turned around 2.5 years old, I was like, I want to get fit. I want to get a little bit more lean. So I started like working out. I was doing regular training. And in that whole process, there was a stage where I did a little bit of CrossFit. So again, not everyone's body is meant to lift heavy weights, but you wouldn't know that until you went and tried it. So I did that. And while doing that, I didn't feel very comfortable. It wasn't a very strong feeling. So I just like, I didn't look or pay attention to that much. And then eventually I started doing personal training with one of the trainer, and she was great. But then she liked to push during the workouts. So
like
she was always, and again, she was coming from that CrossFit background. So she was like, we need to lift weights, like, try if we can every week. She wanted me to amp up weights. And I'm like, I don't know, like I'm very happy to go easy. That's not my goal. But she was like in that, and I'm not blaming anyone over here, but you don't know what's right for you, what's not, until you are at the end of it.
In the gym, that's the whole setup, isn't it? What's your PB now? Push, push. So yeah.
Exactly. And I think in that whole process, this is how it surfaced. Like, it started as a left hip pain. It wasn't constant or anything. It would come, and then I would feel sore. And then, maybe I would put a heat pack, maybe do some more like a core related exercises, and it would then settle down. And then again, if I'll do something else in another 10 days or something, it would again surface. And then again, 2 or 3 days of a bit of extra care, attention, maybe a couple of Nurofen, Panadol, and then I would be fine. Then came a point in the next 2-3 months where it was like pretty much annoying me like every week. And I'm like, this is just not feeling right. So I went to my GP. I'm like, I just don't think this is right. I want to know what it is. So he's like, it feels more like a tendinopathy. How about we do an ultrasound, and that'll show us the real picture. So we did an ultrasound, and that's what it said. Like, it was a bursitis/tendinopathy. So I saw another physio. GP's recommendation was go and get a steroid injection. And I'm like, I would rather wait. I would rather manage it conservatively first. And if it didn't, if I don't see any result, yes, of course, that option is always there. And then I again consulted another senior physiotherapist, and she agreed to me. And she's like, let's do this and see, how it helps. And I'm sure you're quite young. It's something that we can easily manage. So for good 6 to 8 months, this is what I kept doing. Like, I consulted I consulted 2 physios apart from myself who was self-managing it. I started doing Pilates. Even in training, I was like, I made it clear that I don't want to lift heavy weights. My trainer got changed, someone new came. So, a lot of incidents happen. And then eventually there came a point I'm like, I'm just frustrated with this pain. Like I just can't keep popping Nurofen every now and
Yeah.
then, and I'm doing everything that I should be, and it's still not resulting. Maybe I just need to sort of address it in a way that it'll give me a long-term solution. So I got a corticosteroid injection right into the bursa. So for first 2 days I felt brilliant. Like I'm like, that's it. Like, this is gone. This is
Yes.
never going to come back.
We've solved it.
Yeah,
Yeah.
I've solved it, sort of. And then in 2 or 3 days we were traveling somewhere, and I was with my kids, and we were on the beach and playing and things like that. And then the following day, after that whole weekend, there was like this constant dull ache. Up until then I never had a constant pain. This pain felt a bit different too to what it has been in the past. So again, my, like, my voice, inside voice was telling me that this is not right, something is wrong, this feels more from the joint, within the joint. I again saw my physio who was treating me at the moment, and she was also like, no, it'll be fine, let's try this, let's do that. So we tried all the conservative management. Getting frustrated, went back to my GP. I said I wanted to have an MRI. I just want to know what's going on. Like, I don't think so ultrasound is going to give us a full picture. We need to see inside.
Yeah.
And then I went and got an MRI, and it was a labral tear. So there is a bit of a cartilage on top of your, like,
The joint,
articular
yeah.
cartilage inside
Yeah.
the joint. So there was a tear on it. So when my GP called me and said that this is what you've got, I was very happy. I'm like, that's great. I've got a diagnosis. So when you've got a diagnosis, you know what to do. You can treat, and that's it. Maybe it might involve a little bit of surgery. We'll see what happens. I didn't know that was not a good news.
Yeah.
The whole story after that was nowhere near being happy. It was just, I went downhill from that. The events that happened after that, the management that I did, I don't know how much it helped me to heal. It did. I think it did help me to heal, but at the same time, it also created a lot of other issues within my body, because I think it took me a long time to reach a point where I can actually, get that surgery done.
So what was what was compromised?
So being in rural again, and this is, I'm talking about 2022. So we were just, everyone was coming out of COVID. And as you would know, each and every medical professional, health professional was slammed with work and not having enough professional services available. So this is in July, my doctor saying that you need to go and see specialist. I got the reference and I called the practice next day for an appointment. They are like, the earliest we can get you is in October.
Wow.
This is like July and October, and I was like, how do I survive till then? And this is just a consultation that we are talking about. Whatever the treatment, we don't know when that's gonna happen. So again, like, I was put on quite heavy anti-inflammatories and also other, like, opioid medications, like really strong pain medications, because at that point of time, nothing else was helping me, like no other conservative management, no exercise. I was to the point where I was struggling really, really bad.
Right.
Things in my personal life were also in a way that they were not helping me. My grandmother had survived a really big fall then, and she got bedridden.
Right.
This is back in India. My mom and dad were with me at that point of time, but because she was nearly, like, she wasn't paralyzed or anything, but she couldn't move from below her waist. Like, the pain was so much. She was nearly 87. So, things were not being managed really well back in India. So my parents were in constant, like, distress because them being here, not being able to look after her. So eventually they decided that, they would like to go back home. So, and I'm like, I understand that, but I was also going through a lot. But
you have no support.
And they also knew that. And this was the time where we were building our new house. So they came over to help me to move the house and everything.
So everything's happening.
Everything was coming to me from each direction. Like, there was a storm that I was going to get trapped into. So, your emotional side is also not helping you. So there are triggers, like, they influence everything.
Of course. Yeah. And even your healing.
Yeah. It doesn't allow you to heal because I was under constant stress.
Yeah.
And then they left. And then I found out that I've got this. I had no help around the house. My husband being the dentist, so obviously he was flat out busy with his work. He would leave 8 o'clock in the morning, wouldn't be back home until 6. Drop offs, pickups, lunches, dinners, after school activities, so much. And like walking from here to there, I wasn't sure how I'm gonna do it, like, because I know it's gonna cause me pain, and more I do it, it just aggravates everything. I see the surgeon and he's like, this is what has happened. And he's like, look, you can go for surgery. Of course, that's an option. We do an arthroscopic surgery. So it's not like an open hip surgery. So we just put a tiny hole in there. We go in there, we see, have a look, and then we repair it. But he's like, I'm not sure whether your pain is going to get better with that or not. I was very much disappointed up until then by all the professionals that I had met in relation to my issue, because I wasn't being provided a clear picture of why do you say
What's
that? Like,
actually
what's
happening,
actually happening. And I think the biggest issue I feel after, like, thinking about it, was because there was no cause. We didn't know what was the cause. Back then, nobody could tell me that, oh, this is what you've done and this is why it has happened. Like,
when you say that you were disappointed from the health professionals, so where was the disappointment coming from?
I think communication.
Where were they missing the mark?
Particularly with my specialist, I expected him to, whatever it was, or whatever the reasons that he had with regards to why he thinks that surgery might not be the cure for my problem, or why I might still be, suffering with pain afterwards. There were no explanation. There were no in detail, putting up scenarios in front of me, telling me that this is what is happening and this is why I think, and maybe these are the options we should actually look into, or maybe you go to see this one.
So there was a statement.
Yes, there was like the decision was left on me that I can do the surgery, we can go for surgery, and we can see whether that works or not.
Yes.
After the surgery, how my recovery was going to be, how my rehab was going to look like.
There was nothing.
There was nothing there. So I think there were missing like links in between that nobody picked up. I can't expect myself to do it because I was, again, being a patient here, not being a physio. So I was very clouded with everything that was going
on in your life.
In my life.
general,
Mentally, I was broken. I was shattered. I didn't know what anxiety was up until then, but I became a very anxious person. Like I lost the spirit of living life. I was waking up and I just dreaded the whole day. I was like, how am I going to get through this day? I did not look forward to my day. It was that bad. Like I would be crying in bed all night. It was really bad.
I bet.
I really felt disappointed in that time. And a part of disappointment, which was completely wrong on my part, was feeling disappointed in myself, feeling disappointed in my body. I was like constantly blaming myself that why I'm not recovering, why my body is not healing, why, like,
because I'm a physiotherapist.
Exactly. And I've tried everything. I've done, everything that I would recommend someone. I've done all of that. And my body is still not budging. Like it's still giving me so much agony. Plus, up until then, obviously, being a mom, the roles that you play, you are the source of energy of your family.
Exactly. For everybody
you
else.
are the one who looks after everyone. You are the one who keeps everybody organized. You are the one who sort of picks up the slack where you feel like things are falling apart.
Yeah.
And now I was the one who needed all of that from everyone. I wasn't able to delegate. My delegation skills are very, very poor. I'm working on them. I couldn't delegate. I couldn't verbalize myself, and I couldn't say that this is what is happening. I need help. Please help me. I couldn't say that. And B, I didn't have anyone to say that. Like my kids were so young.
Yeah.
And it was
right.
only my husband, and I could see he was slammed with work. So
who do you say
who
it
do
to?
you say it to? And then, it has to come out in some form. So, you become bitter. There is this negativity around you. There is resentment. There is a grudge. Like, in the evenings where I struggled the most, I forgot how to laugh, and I forgot how to smile. I completely forgot what happiness feels like. We are so great at putting up a mask and facade. We would go
Absolutely
out from
fantastic.
8 to 9, like you wouldn't know that what I'm going through.
No.
Even in community, with the kids, friends and moms, and like, you sort of, you don't let your guards down. So you're still there. But when you come back home,
You're done.
you are done. You have nothing left to sort of like, maintain that facade. And plus it's your own space. So you feel like, now I can like be myself. And then, yes, then the resentment, then the bitterness. The kids would be like, why are you never happy? Like, why are you so angry all the time? And screaming, yelling would also like, come to the surface. So it pushed me in that direction. And obviously that disappointment was the core of that, because I blamed myself for my injury. And again, the fact that I was a physio, how did I let that happen to myself? This is the part where I really feel whoever is going through anything in their life, they need to understand whatever position you are in, there are still going to be so many factors and things that are not going to be under
In
your
your
control.
control.
Whatever, how many right things you do in your life, but things that are meant to be, you are meant to have certain experiences in your life, and you will have them.
Yeah.
Even if you don't like them, you have to
You
go
will
through
have
them.
to.
And this was something that I could never imagine that could happen to me, and it happened. And when I was in there, I always felt like my expectations was like, oh, maybe 2 weeks, maybe 3 weeks, maybe 6 weeks, it's going to get better. So that was another mistake that I feel a lot of us make with regards to our expectations from coming out of any injury or any impairment or any sort of such situations where your body needs more time. So it's very important to set realistic expectations. I've been recently using this word, and it's like you need to pace your expectations.
That's really good. Pace your
Because
expectations.
as a
Yeah.
physio, we always teach people activity pacing. Someone comes for cardiac rehab, so obviously their heart has gone through this big trauma in a way. 2 years back, that person is like, I used to run marathon. And then he's
Why
like,
can't I do it now?
yes, and he's like, oh, this is like, I wanna participate in a marathon that's coming in 3 months. And it's like, yeah. So and that's where we teach them, it's activity pacing. You have to pace your activities. It's week 1 after your bypass, so maybe we can, normal things that you can do right now is maybe walk from your bedroom to your toilet. If you can do that, that's what you should be looking at. So you need to pace your activity. You need to conserve your energy. And gradually by doing that, you do eventually reach to your goal. But we have to sort of, make a plan. We have to judge how your body is also responding to that sort of amount of activity. And you pace it out. And then you eventually get there.
Yeah, you'll know.
But again, like with your activity pacing, if your pacing with expectation is not matching,
Not a good match. Yeah.
yeah, it is going to throw you out. It is
Yeah.
going to throw you off mentally, because you will be constant in that state of, oh no, my body's not doing, disappointment. My body's not doing what I need it to do. So I didn't pace my expectations. My expectations were very unrealistic, considering what has happened and how length of a time I have been struggling with that problem.
Yeah. So it became more chronic.
It absolutely became very chronic.
Yeah.
And I feel like chronic pain up until then was something that I never really understood, and I never really took it that seriously. Even being an allied health professional, like it was in a way very transactional. Someone tells me I'm in chronic pain, and then I would tell them the strategies, and whatever problem they come up with, I show them depending on like what,
like very textbook.
very textbookish, yes. But now I believe them, and I understand that yes, chronic pain consumes you. It consumes not only as a person mentally, it is something that takes over every other aspect of your life. Like chronic pain is a slow poison. The resources and the tools that will help you are out there, but you need to understand, you need to accept the fact that this is what it is, this is what I am suffering from, and I need help for that. So I think accepting whatever that it is in terms of injury that you're going through, I think that's the breakthrough. You have to accept the fact that that has happened.
Yeah.
You have to accept that this is what is the need in that hour, and whatever that might be, you will not like it, but you have to accept it, and you have to move on. Acceptance is the biggest tool that you need.
Wow. I think I'm just going to go back a little bit, Payal. When you said that from a physio perspective or from anyone who has an injury perspective, they need to understand that there are normalities, but then there is a deviation, which means the approach that's being taken needs to be deviated as well. I think that's the highlight for me, that whether you are, when we are a health professional, we do think in a very structured way that this is the chief complaint, these are the symptoms, these are the signs, that's what's happening, right? But sometimes we do need to like take those those blinkers off and think outside the box and do some lateral thinking.
Yes.
And think maybe they are not in the normal norms, maybe something
Yes.
else is happening. And I think that's where the listening comes in, isn't
Absolutely. Absolutely.
Yeah.
Because people who are going through that, whatever that symptoms or whatever that condition is, they usually know something isn't right. They usually, when they come and tell you that I'm feeling this, I feel like you need to read in between lines. And yes, you may not get that right in the first consultation or when you see them first.
Very important,
You will
yes.
not get that right. Maybe you stick to your textbook management, maybe do that, but when they come back, they will tell you that it didn't really help me, or I did this but it still sort of makes me feel like that, my pain is still around that. Then try and dig in further, and after you've tried everything up your sleeve, you feel like still there are missing pieces, still you don't see this patient where they should be by now. That's another alarm bell that should ring in your head.
Like it should add up.
It should add up.
The facts, what they are telling you, and the approach that you have used,
It should add up.
It should add up.
Yeah. Unfortunately, pain sometimes can become an over barrier. You just have to not ignore it, but in a way, you have to desensitize
You have
your
to park
brain.
that on the side and then deal with the problem at hand.
Exactly.
Because it can cloud your judgment and the patient's judgment.
Exactly.
Would you say so?
Exactly.
Yeah.
Absolutely.
Yeah.
Absolutely. So it's again a two-way story. Like, you help them to sort of look past pain, and at the same time they help you to sort of indicate you that maybe there is something
Yeah.
that we need to look into.
Look into that.
We need to do our further
Yeah.
research. We need to ask few more questions, assessments, whatever that might be, to make sure that we are not missing something that is going to help them. Yeah.
Perfect. Thank you. That was good.
No worries.
Thank you, Payal. Thank you for listening. I hope you got something out of it. Follow me on Instagram and subscribe on YouTube. Thank you.